Welcome to the Hashimoto's Doctor podcast. You're now part of a growing community of people determined to take their health back through education and self-empowerment. But because of the healthcare system today, we don't have access to the types of healthcare that we want. So we have to do things differently. We've got to do things smarter, and we do that by becoming our own advocates. This podcast will give you the perspective and thoughts of one of the world's leading Hashimoto's doctors. So let's get started. Hi everyone, Dr. Shook here. I hope you're doing well today. Today I want to talk to you guys about a very important topic and something that is commonly seen and found with in those that have Hashimoto's, and that is depression. And this is something that is, I see it so frequently when I work with people one-on-one, whenever we're working with and trying to help give people ideas of what might be occurring or going on in our groups. And this is one of the things that's it's more complex because there's more than one cause. And as you guys know, if you've been following me or if you've become interested in what actually causes the breakdown in our body and a lot of different symptoms and disease processes to manifest, you realize really quickly that it's not quite as simple as just identifying one thing that's causing your problem, right? There are usually multiple things that are contributing to multiple symptoms. So in order to try and improve that, you have to address the multiple things to the best of your ability at one time. Okay, so that's kind of vague, but let's get a little bit more specific about this. So when we're looking at depression, number one, probably one of the most common things that we'll find, and something that always has to be ruled out, is that there's poor thyroid activation, so poor thyroid hormone activation of the cells of the brain, the neurons, the nerve cells in the brain. When you have poor thyroid hormone activation of the nerve cells, they do not fire to one another efficiently, and it results in the manifestation of a lot of different symptoms. One of the most common symptoms we hear about is brain fog and depression. People can't think clearly. They have just these problems with their mental focus. These are all and can all be created by poor thyroid hormone activity in the brain. And so when you look at that, the reason I want to say poor thyroid hormone activity is because it's not as simple as a quantity, only looking at quantity or the amount of the hormone that's in circulation. That's the traditional and conventional model. Looking at the hormone is a good first place to start, obviously, because we have so many people that have low hormone levels. But for millions and millions of people, the hormone itself and getting the quantities up does not help them. It may help them some, but they may not see significant improvement. They may see some improvement. And so there's a spectrum, right? Some people respond very well, some people do not respond well at all. And that's because there are multiple mechanisms driving this problem, guys. And until we recognize that, we acknowledge that, and we start looking at the drivers and causes of some of these other problems that cause your thyroid hormone to break down, the physiology to break down, not the hormone itself, but the availability, the sensitivity of your body to the hormone. Until we start looking at these other, 20 to 40 additional problems and processes that we often see occur in people that have low thyroid symptoms, and we start addressing all these things at one time, and it doesn't have to be unbelievably complex, but it does require investigation, we're going to have continued problems and people that continue to suffer. So it's not acceptable, and especially when we're talking about something as debilitating as depression, we have to be, we need to do our best, guys. So we've got to consider more than just the quantity of the hormone. So that's number one is, basically poor communication between the brain cells due to poor thyroid hormone activity. Number two is going to be unstable blood sugar and its role in contributing to depression. One of the most significant things that we'll see happen with blood sugar fluctuations is that when blood sugar spikes upwards, when it goes up, there is a release of insulin by your pancreas. Now, one of its jobs is to try to get that blood sugar that's in the bloodstream into the cells of your body so that your cells can use it to produce energy. Okay, that's really the job of one of the primary roles of insulin. And the issue becomes, even if you have low blood sugar and your blood sugar is low and then you eat, let's say you have huge gaps between meals, when you eat, let's say after 5 hours of not eating or 6 hours or whatever it may be, then you're going to have a rise in blood sugar. And if that rise in blood sugar will be, it will complement, or it will be complemented, or it will be matched, let's say, by a rise in insulin. Because insulin's job is to try to get that scarce blood sugar that's now available into the cells of the body to produce energy. So what ends up happening is that this rise in insulin has some other effects. One of the things is that it increases an inflammatory chemical in your body. This inflammatory chemical is a cytokine. You don't have to know every detail about what cytokines are, but you need to understand that interleukin 6 is an inflammatory chemical. It's produced by the immune system. When insulin goes up, so does interleukin 6. And interleukin 6 we know has been associated with, especially when it's elevated for a prolonged period of time. It's not good or bad per se, but what we find in pathological processes is that these inflammatory chemicals tend to be an underlying theme that we see, where they drive more chronic disease over time. And so we know that inflammation is important in our healing process, but when it's prolonged, it creates a lot of problems for us. So for one thing, you don't want these recurrent spikes and dips because it will drive inflammation. We know that inflammation in and of itself can create a lot of different problems for depression. When you start looking at what researchers have been noticing, is that almost all depressive disorders have some degree of inflammation. Okay, some increased degree of inflammation. So we've got to do everything that we can to stabilize and lower inflammation. Now, the other thing with blood sugar is that blood sugar spikes and dips will also create hormonal imbalances. In particular, it will create problems with your cortisol, which is your stress hormone, and that will spill over into your sex hormones like your testosterone and estrogen, which can create a lot of different problems with mental focus, as well as these blood sugar fluctuations can throw off your neurotransmitters, which are what most people and most doctors are typically trying to assess and evaluate. They're trying to look at and determine whether or not someone needs an antidepressant, and they're really trying to look at the manipulation and or support of neurotransmitters. So anyway, that's a very important point. Okay, so blood sugar is important. Now, another thing that we find that's a very common and very commonly associated with depression, especially with Hashimoto's, is a very unhealthy gut. Now, the digestive tract itself is, the wall of your digestive tract is a barrier, guys. It is a selectively permeable barrier. It is part of the immune system's, it's really an immune barrier. When you look at it, as a barrier system of the body, it keeps things away and out of the body that you don't want there, and only lets things in that your body needs to thrive and grow. Okay, so when this barrier breaks down, it can stimulate immune responses, which drive an inflammatory process, which we just discussed is a problem for depression. Now, we also know that the gut bacteria, if you have imbalance, or what is commonly referred to as dysbiosis in the gut, that those bacteria have very crucial and critical roles in their function throughout the body, and in regulating immune function and taming inflammation. They're absolutely critical. We could really go on and probably talk for a long time about the gut and its role, but I don't want to. We've got a lot of different podcasts and videos that we've done. You can find on Facebook and YouTube, typically, where we go through and I discuss this in more detail. Now, beyond that, number 4 is poor circulation. Listen, if you can't get oxygen and nutrients to your brain, you are going to have a lot of problems with depression and brain fog, because you're not getting glucose, you're not getting oxygen to the neurons and nerve cells of the brain, which is absolutely critical and important for normal focus and concentration. Number 5 is going to be autoimmune diseases and drive chronic inflammation, which lead to and can contribute to depression. Guys, anytime you're autoimmune, as a byproduct of the autoimmunity, when it's active, you're going to have an increased inflammatory load. Remember the cytokine I mentioned, interleukin 6? Well, you have an increase in cytokines because every inflammatory process, these cytokines are produced as a result. So whenever that occurs, it disrupts a lot of physiology and creates a lot of these problems that we can see with neuron signaling, which is a nerve cell, firing, and proper communication of the nerve cells, which all these things, there's so many problems that come from chronic inflammation. I mean, we could go on and on and on with the physiological problems that occur. So I just wanted to go over this with you guys because I think it's really important that you understand that there are a lot of things that can cause depression with Hashimoto's. It's definitely multifactorial, right? So we've got to be aware of these things. We need to look at the whole person, and we've got to figure out how can we start to work, to address as many things at once. And guys, the ways that we do this are really through dietary approaches. We do a very, very good assessment using laboratory analysis first to give us data, like what's actually wrong, and then what can we do about it. And then we begin taking that data and formulating a plan that's specific to you, that's more precise, right? It's called precision medicine. And we want to take that and apply it to your unique circumstances so that we can have the best opportunity to have good outcomes. That's really what we want to do. And there's a lot more to it than just the thyroid hormone quantity, especially when it comes to its contribution to depression that I want you to know about. But guys, I hope this helps you out. I really appreciate you. I hope you have a wonderful, wonderful day, and I hope that this has, helped to improve your understanding of your problem or someone's that and it really helps to make the world a little bit better today. So I appreciate you guys a lot, and I will talk to you soon. Thanks. Thanks so much for listening. We hope you enjoyed hanging out behind the scenes with Dr. Shook. You can also talk with and learn from Dr. Shook through Facebook Live on our Facebook page at the Office of Dr. Brad Shook. Don't forget, you can also get access to our videos, guidebooks, and thyroid programs at www.drbradshook.com. Oh yeah, and don't forget one more thing. We can change the world one person, one family, and one community at a time. Until next time, remember, today is your day, and no one will tell you who you are and what you can be.